So we've talked about history and sleep medicine. We've talked about the history of dental sleep medicine. Probably one of the next relevant things to talk about is its relevance to dentistry, because although it straddles the medical and the dental field, and we're constantly reminded of that, but nonetheless, why would it bother anyone who wasn't going to get involved in dental sleep medicine, by which I mean if you're going to make some kind of oral appliance, okay, well then you need to know about it. But what about if you either are not really interested in your practice, is really busy and you haven't got time for all that, or alternatively you do recognise it's important, you do screen your patients and you send your patients out to have the work done elsewhere. So why would it bother you? And well, there are several reasons. The main one perhaps is because it has such an impact on the work that we do. So it's considered to be within our remit. I mean, who better to know about the impact on the mouth of a medical problem than the dentist? The dentist sees his patients on a regular basis, unlike a physician. A physician sees people when they're sick. Doesn't always work this way, but we're supposed to be seeing patients to maintain their health. And so what a great opportunity when we're seeing people regularly, especially those that are not coming in with something on their mind anyway, of an emergency or highly urgent nature. This gives us an opportunity to educate our patients and at the same time to educate ourselves. And then in so doing, incidentally, we're able to spread the word even wider to the patient's physician, because at this point in time we need the physician on board anyway. So going back to the first one, perhaps the most important thing here is that there is a lot of impact on our everyday dentistry, and obviously we're going to be going there as time proceeds. But I distilled this down to two things. Number one, who better to do it than us? And I would just put a little caveat in there and say, if we don't do it, someone else will do it. So who better to do it than us? But if we don't do it, we're going to lose the responsibility of this, and this is in our area. This is in our domain. You know, we live there. This is what we do every day. And then the second thing is that it has a lot of impact on what we do anyway, so we can't really ignore it. Well, you can, and you ignore it at your peril. And I'm not talking about medico-legal aspects of dental sleep medicine, loss of airway and that sort of thing. I'm talking about broken restorations. I'm talking about TMD. I'm talking about facial pain. I'm talking about excessive wear on teeth. I'm talking about cosmetic. I was going to say. I was going to just say damage. I suppose it's a bit more involved than that now, because our expectations are so far advanced than they were before. But it's certainly fair to say in many societies where once, providing you had all your teeth, it was good, now when I see patients in a general practice setting, it's patently apparent that people don't like their incisors to be flattened off. In fact, I've seen patients who dentists have flattened them off for one reason or another, and I've never seen a patient that's particularly happy about that either. So I think there's an awareness amongst patients that not only are these other things going on that they're not happy about, but there's also the cosmetic issues that they're beginning to get aware of that they're not happy about. The the thing to consider here is they still don't know why they're having these problems. Whether it's excessive wear, whether it's the consequences of underdeveloped jaws, or condylar compaction or whatever, and you know, TMD pain, whether it's having to have orthodontics in the first place. These are things that they have yet to learn. So it's nice that we should be one step ahead of the game, so that it's us that tell them rather than Google. So so that was just a quick, almost what do they call it? Segue. That was a quick segue between the aspect of where we've come from and why we would want to go where we're probably going. So thank you, and on to the next one next time.